Good morning and welcome to the teleconferencing session of PGD HHM program. Friends, if you recall that last time we have covered your course 4, if you see PGD HHM 4, some of the clinical areas we have covered. And as I told last time also that what we'll do in this teleconferencing for 3 sessions, what we'll be doing that whatever the remaining areas of the course 4 that we'll be covering, and subsequently we'll be covering the areas from that utility and sports services, that is course 5. Some of the topics we'll be covering from course 5. So again my request to all of you will be that please keep on asking questions. If there are certain queries, if there are certain questions in your mind, if you are not clear about something which is given in the book, and when you are attempting your assignments, when you are doing some attending your contact program, if there are certain queries regarding this particular topic, you can ask other also, but that will take later on. But when we are talking about this particular topic, if there are any queries pertaining to this, you please feel free to call us, or you can send fax also on the numbers which will be displayed on your screen. So this session, this next 40-45 minutes, we are going to cover 2 very important areas, that is diagnostic services. If you see, the title of your course 5 is the clinical and the diagnostic services. And last time we could not cover the diagnostic services. We have covered blood bank and other areas, OT, we have covered OPD, but we could not cover the diagnostic services. And today we are going to cover the laboratory services and the radiological services. And to tell you about these 2 things, that how to organize, plan, and these radiological services and the laboratory services, I have with me Colonel S.K.M. Rao. Welcome, Colonel Rao. I think you are very familiar with him. He was there also in last teleconferencing. Colonel Rao, welcome. I think please tell our students that if they have to organize the laboratory services or radiological services, how they should go about that, what are the considerations they should keep in mind, and maybe if time permits, we can discuss some of the managerial issues in radiological services.
Thank you very much, Dr. Arora. Today we will be talking about very, very important aspects. He has already clarified that these are supportive services. These are called supportive services and also called diagnostic services, laboratory as well as radiology services. They have a lot in common. They are very, very important nowadays, and they will give you complete supportive backup in terms of diagnostics, which can reduce your average length of stay. This will also give you a lot of cost margin. It is actually a revenue center. The importance of hospital laboratory services is there are a lot of investigations which have increased, laboratory investigations nowadays, and there are almost 350 investigations, major investigations. There are many multiple investigations which are there, but approximately they say that almost 350 investigations are there. It is a cost center in terms of revenue as well as in terms of expenditure, but it is considered as a profit center also by the hospital. Avoids admission because of investigations are done, and only for the investigation purposes the admission is not required. It also decreases your average length of stay in the hospital. What are the objectives of laboratory? This assists arriving and confirming at the diagnosis. It can store reports for the reference purposes, which has a medical legal connotation. Later on we will see. Conducts tests in emergency cases, and 24 hours a day it is functioning and providing you results in an emergent cases also. Teaching and training center for all the laboratory technicians as well as healthcare workers. Research also it carries out in terms of community research, in terms of clinical research, both it supports. Now I'll tell you three most.
It means that they are not only the diagnostic thing, but they are also dealing with the research and the
Yes.
training part of all.
Yes.
The training of the workers and research regarding the various tests.
Yes. It's
That's
a referral, it acts as a referral center, it acts as a research center, it acts as a training ground for entire gamut of hospital infection control as well as safety aspects. All those aspects are covered under laboratory services. Actually, I want to bring out three most important aspects of laboratory services. Laboratory services are provided as per the requirement of the patient is one aspect. Another aspect is quality assurance, and another aspect is a safety assurance.
I think these are very
These are
important.
these are very
Nowadays
important.
quality and the safety of the laboratory services, it is much talked about
Yes.
the topic.
Yeah.
And I think this is not very well covered in this thing, but
Yes.
students
So,
need to know.
yeah, so we will discuss this in detail about specific these three aspects about the scope of these services. Then is the quality assurance, and third one is the safety. Similar pattern we will have for the radiology services also. Same pattern we will go. Safety aspect is also very important in radiology services. As far as laboratory services are concerned, the scope of laboratory services are commensurate to the services provided by the organization. For example, if it is a cardiac hospital, then we need to have some cardiac enzyme tests also being carried out. That is the example which I always quote, that the scope of the laboratory services should be whatever services hospital is providing according to that. We must have a qualified and trained personnel performing and supervising the investigations. In this, we should have, as there are accreditation standards which have come up, I am talking actually from that only, that NABH standards, they cover laboratory services, and NABL specifically covers the laboratory only. In that, very stringent requirements of the trained staff is there. Policies and procedures guide collection, identification, handling, safe transportation, processing, and disposal of specimen. Each and every word is important here. The collection, identification of the sample, handling of the sample, safe transportation to the laboratory, processing there, and the disposal finally after the test is carried out is very, very important. Laboratory results have to be made available to the client or to the patient within a defined time frame. There is a flexibility in this, that you can have within 24 hours it should be made available. It is possible to provide routine results within the OPD timings itself, so that patients don't have to come back again and again. Critical results are intimated immediately to the concerned personnel. Now this is a very, very important aspect from the patient point of view, where you need to actually inform the critical results immediately to the staff concerned, the clinician concerned, so that they can take immediate action. Now for this purpose, you have to have reference values made for each and every test. The reference value should be available with the hospital. That is a very, very important requirement. And if certain tests are not available in the organization, then they can be easily outsourced to a laboratory which has a definite quality assurance system. Now the second most important aspect which I was earlier discussing with you is the laboratory quality assurance system. Now as we discussed earlier, we have two types of accreditation programs. One is carried out by NABH, that is National Accreditation Board for hospitals and healthcare providers, and another is National Accreditation Board for Laboratories, that is NABL. NABL program is specifically concerned with the various processes in the laboratory, whereas NABH is for overall hospital standards. So laboratory quality assurance program needs to be documented. Program addresses verification and validation of test methods. Its laboratory quality assurance program documented means actually you have to have a quality manual prepared for your laboratory. Then it should address the verification and validation of test methods. Also it should address surveillance of test results. That means there has to be continuous surveillance by all the heads of the departments of microbiology, pathology, and various sections. A sample should be taken out and they have to be surveillance has to be carried out. Periodic calibration and maintenance of all equipment is also very important, because this is the equipment. Nowadays it is totally automated laboratories, and this equipment will give you accurate results. If it is not properly calibrated, then there is likelihood that the results will go in different directions. And the maintenance of this equipment will result in availability of this equipment throughout to the laboratory, so that there is a less downtime and efficiency is maintained. Program includes the documentation of corrective and preventive actions. Whatever variation is there in terms of the results, that can be corrected, and any preventive action in terms of any requirements of equipment can be taken care of in this quality assurance program. Then another very important aspect is your laboratory safety program. So laboratory safety program has to be documented. It should be a part of your organization wide safety program. That means unless it is a standalone laboratory, if it is a hospital, then it has to be merged with the hospital safety program. Written policies and procedures should guide the handling and disposal of infectious and hazardous material. Laboratory personnel should be appropriately trained in safe practices. That means they should be using all the standard precautions, like for example gloves, masks, and various other safety equipment should be used by them. There should be a provision of shower, there should be provision of eye cups in case of any acid spill or blood spill. The shields, eye shields also need to be used by laboratory workers, especially during the pre-analytical phase. All these aspects are very important. Now we'll go on from this aspect towards the management aspect or the planning aspects one by one. As we know, the pathologist is supposed to be in charge of the laboratory. Also there are various other specialists available in the pathology, which are microbiologists, biochemistry specialist. Nowadays molecular biologist has also come in. So all these people are actually required in a laboratory. Medical technologists as well as technicians are heart of the laboratory in terms of the staff. They perform procedure in different areas of hematology, urine analysis, biochemistry, serology, histology. They generate and maintain report, maintain the standardization of equipment, requisitioning and inventorying of supplies and equipment, and supervision of the work of the technicians. Then there are debate about whether it should be a centralized laboratory or a decentralized laboratory, because different trends are there now emerging. But the centralized laboratory gives you more economy, it gives you effectiveness and efficiency. It is easier for a single pathologist or the in charge of the lab to supervise the investigations, and you can have a better technical standards because everything is being standardized and controlled from centrally. In the decentralized labs, it is also called stat labs or satellite labs. There is a rapid availability at the patient's bedside, but different tests may not be available. Only specific tests which are required in that particular area, for example in a cardiac lab or a neuro lab or in the ward lab, those can be made available. There are disadvantages of satellite laboratories, that is you need more manpower, the equipment is needed more, the material requirement goes up, then lack of supervision and control in terms of standardization and control. There could be a laxity in the quality control also.
But the advantage is that it is very easily available.
Yes, it is available at the bedside, patient bedside, especially in the ICU and in the emergency services. We always recommend a satellite lab should be there, so that in emergency any investigations required can be done there. Also in the ICU there is a requirement of having a stat lab because of acid base analysis. Time-saving measure. And accurate results at the bedside. Various functional divisions of laboratory are hematology, microbiology, clinical chemistry, histopathology, molecular biology. Various subsections actually I am not mentioning. For example, immunohistochemistry has come, and genetic laboratory has also come. So all those areas are increasing, but by and large these are the salient divisions of laboratory. Then various planning parameters for the laboratory depends on the number of tests which you are carrying out, type of tests which you are carrying out, whether your functioning is manual, semi-automated or automated. Inputs are translated into various floor plans, areas, space, equipment, organization and staffing. Activities under functional planning would be to first to determine the section-wise workload, then determine services to be provided, area and space requirement for equipment, furniture and personnel, various functional units it has to be divided, number of workstations have to be worked out, equipment requirement has to be worked out for general as well as technical. So there is some formulas which have been prescribed by various managerial authorities, but these are only a rough guideline. Approximately you will see that 8 to 20 tests are carried out within an average length of, let us say, 10 days. Nowadays, even in the first initial 3 to 4 days itself, all the laboratory tests are over, and in a 1000 bedded hospital you would require approximately 3 lakh to 7 lakh tests per year. As I said initially itself, that there are at least 350 different types of tests on blood, proteins, hormones, feces, saliva, semen, biopsy, intermediate metabolites, but these actually have reached more than 1000, but sub-tests I am not going into detail, but overall there are approximately 350 categories which are there. Now where should be it should be located? It should be located preferably on ground floor. Even if it is on the first floor or second floor, it does not really matter, but your sample collection rooms must be in the ground floor in the OPDs, and that is where the maximum workload comes. So it has to be preferably in the area which does not mingle with your inpatient care. The lab services are preferably, it should be available to both outpatient department as well as to the wards. In the large hospitals, there needs to be separate sample collection counters in different areas of the OPD. Sample collection facilities in the OPD, design, waiting room, venipuncture room, specimen, toilets have to be there, containers with labels available, record keeping facilities, carry out commonly ordered tests and auto-analyzers if they are available, then it reduces the load on the main laboratory. As I said earlier also, emergency lab should be closer to the accident and emergency department, and ICU lab also should be there as a stat lab. On the main traffic artery, future additions and alterations, this is an area which is fast expanding, so you need to have a space for future expansion. Two distinct escape routes from the safety point of view. It should be isolated from one section of the hospital, and access to an incinerator is required because you have to dispose of your biomedical waste. A space requirement, different authorities have given different space requirement, but it is generally an agreed upon norm that there should be one laboratory space unit which should be 6 meters by 3 meters approximately, and the technical staff will be working in this laboratory space units. We'll show you the layouts also. Departmentation is now becoming very less rigid, except for the portion of mycology, microbiology. These sections need to be separate, but otherwise due to equipment requirement, nowadays there is a less rigid departmentation, and open space is preferred where you can install the equipment and work on these equipment as far as laboratory staff is concerned. Flexibility in converting primary space into secondary space and vice versa should be available. Open planning, as I said, is a requirement nowadays. Various auxiliary areas are required for in terms of toilets and pantry or waiting areas, or all those areas are auxiliary areas. Venipuncture cubicle is a must even in the main laboratory also. Specimen toilets is a must for male and females for collection of samples. Pathologist office is a requirement for all the staff. In fact, each staff should have their own separate reporting areas whereby they can concentrate on actual reports. Glass washing, sterilizing section is also a requirement. Then as far as floor is concerned, it should be acid alkali resistant. Ease of cleaning should be there because of the workload. Disinfection has to be carried out regularly. So it is recommended that cement concrete reinforced floors or vitreous tiles are the in thing nowadays. Ceiling should be easily cleanable. Walls should have hard finish, impermeable. Ease of washing should be there because, and the future needs have to be taken care of. Doors should be wide to allow passage of the wheelchairs, and the self-closing doors are required. Lighting, as you can see on your view file, that approximately 200 lux requirement is there wherever they are working areas, sample collection and all those areas. Wash and basins should be available in plenty, especially on the workstations where the requirement of constantly washing hands is there, and the soft water is required all over the laboratory. Electric supply, you need to have a generator backup, you need to have UPS. This is required for air conditioning, it is required for all the equipment, and noise level should be preferably below 50 decibel level. Ventilation requirement is very important requirement because of the nature of the work, especially the microbiology work, where you need to have a separate air handling unit for microbiology area, whereby there is a possibility of mixing of air can be avoided. Laboratories requirement of air changes is approximately 10 to 15. In the store it can be less. There should not be any recirculation, especially from the microbiology area. Temperature requirement nowadays, there are deep freezers which are required in molecular biology also, up to minus 75 degrees centigrade in fact, and with alarm systems. And there is a requirement of calibrating this equipment regularly. Also maintaining the temperature is a must. Walk-in incubator, especially walk-in cooler also, this is a requirement in the laboratories. Communication, intercom and various other communication which are required. Online result reporting is there. Then you need to have computerized information system. You need to have fume cupboards, which is very important requirement from the safety point of view. They actually extract all the fumes which are generated in the laboratories. Another important requirement from microbiology point of view is laminar flow cabinet. Also from molecular biology side also, this is the requirement, especially when you are inoculating the culture. If it is especially a tuberculosis culture, then again there is a requirement of having laminar flow cabinet which draws air and extracts the air outside, and there are HEPA filters which are fitted in this laminar flow cabinet, which actually decontaminates the entire environment. This is a diagrammatic layout of lab module where you can see the workers and layout of the lab benches. Then there are other requirements of gas, air, vacuum outlets which are shown on your view file, and the sink is also there for washing purposes, and this is how lab space units can be accommodated in this design. Waste disposal is a very important area in the laboratory, especially after the tests are carried out. There are blood samples, there are stool samples, there are urine samples, and they need to be disposed of in a manner of Biomedical Waste Disposal Act. In terms of the blood, again the entire precautions have to be taken. Many laboratories are using vacutainers, so this should be kept in mind while discussing this waste disposal. Then various planning norms are based on actually how much time it takes for doing a particular test. For example, these are some of the guidelines which are shown on your view file: hemogram, blood smear, urine stool, but there are n number of other tests which are being carried out, and there are automated tests which have been carried out, which is there is no once you put the sample inside, then there is no requirement of calculating this type of activity sampling. So nowadays the norms are also changing, but by and large certain things have been worked out by various authorities. Like for example, Verma committee said for 70 tests 1 lab assistant should be there, whereas Foley committee has said 1 lakh technician per 400 beds, and in the automated laboratory even 20 to 30,000 tests can be carried out per year by lab technician. So these are some of the norms which are given. Various policies and procedures which we saw earlier about the laboratory, they should be in place and they have to be standardized. Even for the accreditation point of view, these tests are these policies and procedures are very important. Policies for laboratory samples, how to receive the samples, request forms, time for accepting samples, containers, identification of the samples, how to report, how to record. Blood bank, of course, we have seen last time.
I think there should be written document
For all of this.
Standard OPs,
yes, standard
SOPs,
SOPs and policies and procedures have to be there for each and everything. In fact, it is said that you must have 3 types of issues covered under the laboratory in terms of policy procedure. It is called pre-analytical, post-analytical and actually analysis which is carried out in the laboratories. So 3 different headings under that you have to cover this complete program of quality assurance in the laboratories. So these are various types of things which we discussed about the laboratory, and I think now if you want to ask any.
If there is any question from any center regarding the laboratory services, Dr. Colonel Rao has told you what is the scope of the laboratory services, and then subsequently he has told you about the quality assurance part of the laboratory services and the safety measures. And as he told you that there are more than around 300 tests which are being carried out in laboratories, and he has also told you about the NABL norms also for the labs for ensuring the quality of the laboratory services. But still, if there are certain things in your mind, you can please ask those questions. Till that time, what we'll do, that we'll go on to the another important area that as you were mentioning, that the radiological services. There also, if we see radiological services also demand that again the scope of services, and then the quality is also very important, and then the safety measures are much more important there in radiological services, because the persons who are engaged in the radiological department, they are exposed to the radiations, and they have got hazards of this, they are exposed to the radiation hazards also. So how to protect that also, I think that is also one of the unit in the this course. So can you tell our learners about that particular aspect also?
Yes, now I think we will discuss about radiology services and radiation hazards. As Professor Arora has already pointed out, that it is a very, very important requirement in terms of, because actually it is a statutory requirement in terms of Atomic Energy Regulatory Board guidelines, which are a statutory requirement, and the hospital has to follow that. Even the standalone diagnostic centers also have to follow these standards very, very meticulously. Actually, the clearances are given by AERB itself. So now we will go on to the radiology services. As you all know, that
one thing is that, sorry to interrupt you, that should we call it as a radiological services, or nowadays they are named as radiological and imaging services?
Yes. They are in fact imaging services. Imaging services also involve wherever there is a radiation is not there. For example, ultrasonography is also part of your imaging services. So we will see one by one as we go ahead in our discussion. First we will talk about imaging services in terms of radiation, and then the non-radiation sources also we will cover. So as you are all aware that Konrad Röntgen was the father of radiology. So from that we will start, and as you know that this section works 24 hours a day, just like laboratory. It provides the support. It is again a most costly department nowadays, because almost 20 to 30% of equipment budget is actually spent on radiology equipment, and it is a most costly department. Many times this equipment remains out of order, and as I have already said that AERB guidelines have to be followed for these services. The digital imaging, which has come in a big way, is helping this department to grow further. But what are the contents of this radiological department or imaging department, as Professor Arora brought out? General X-ray unit, mobile X-ray unit, fluoroscopic units, mobile image intensifiers or C-arm, what we call, specialized fluoroscopic and angiographic facilities like cardiac cath labs, ultrasound imaging, X-ray mammography, CT scan, MRI, dental X-ray units, mobile diagnostic imaging services provided in various vehicles also, part of your modern diagnostic imaging. Now radiology services traditionally have been now divided into radio imaging services, nuclear medicine and radiotherapy department, and they have become the departments themselves. Like nuclear medicine is a separate department now, and radiotherapy department is a separate department. So here we are talking only about radio imaging. In terms of conventional, interventional, USG, CT, MRI, DSA, mammography, these are the main services which are transmission based services. This is definite advantages of plain X-ray, that this most inexpensive method of diagnostic, rapidly obtained, portable, it can be carried out in the wards also, and also there are some disadvantages that soft tissue changes are difficult to detect. There are various planning consideration in terms of number of hospital beds, annual hospital admissions, bed occupancy rates, patient X-ray load in terms of inpatient, OPD, accident emergency, operation theatre, ICU, patient load of ultrasound, CT, MRI. All these aspects have to be taken into consideration while planning radiology services. Hours of operation of the department, future expansion facilities, and based on this we'll consider what are the rules of thumb. Actually this depends on actual workload, but some rules of thumb have been made in the radiology services. For example, one X-ray machine can provide service up to 1 lakh people, and X-ray installation is useful even if only 4 to 5 patients are X-rayed a day, but by the same machine. X-ray room when adequately staffed, makes 50 examinations per day. These are rule of thumb, but many people are exceeding this, but these have been made due to the purpose of radiation also. 1.3 to 1.5 examinations per hospital bed day per week is required. One examination for 5 to 6 outpatients visits, one examination for 2 to 3 emergency patients. So overall, if you see, there are approximately 5,000 to 7,000 examinations can be carried out, radiological examination in a single room, that is radiology room. For non-teaching hospital, one diagnostic room for each 20 is also an accepted guideline. So in the teaching hospital, as we brought out, 5,000 examinations to be done by radiologists per year, 2.5 radiographers per X-ray room, 0.5 to 0.8 technicians per X-ray room, and one nursing aide for 6 rooms is good enough as a planning parameter. Pediatric load is approximately 10%, so there are requirements of short tube, high powered operations. Because the patients are unquiet, you require additional staff to handle this. There are other parameters in terms of distribution of X-rays. Chest X-rays are maximum taken, gastroenterology covers around 25%, extremities 15%, head and neck 7%. These are only guidelines. There can be variation as far as different types of hospitals are concerned.
That depends on the
That
type of
depends on the
hospital.
type of hospital also. There are various calculation, as we saw, 50,000 procedures if you are going to carry out, then you would require approximately 10 X-ray rooms as far as different calculations are concerned, depending on the time requirement of examination, the turnover required per patient, the changing requirement, and all those things considered together. The location, as you are aware that there is a heavy equipment involved in this, plus the radiation safety requirements are there, so it's better to be on the ground floor where you can have a separate generators, consoles, also substation for this purpose. Weight of equipment is a very important aspect. So various cabling requirement is there, and then need for CT, MRI is there, so future expansion needs are also taken care of. Adequate reception should be there, convenient patient flow with minimum crisscross traffic. Radiography rooms should be grouped for efficiency so that dark rooms can be utilized accordingly. Lead line doors and windows are there. Radiology rooms are generally windowless, and even if the windows are required, they have to be at a height of at least 3 meters. Various types of parameters are there, like for example BIS guidelines are there, so I will not go really into the details of that, but a general requirement is there that a radiography room should be approximately 21 square meter and above. Various workflows are there on the diagram, like for example how from dark room, viewing room, doctor's room, collection, storage, how the patient flow is there and the film flow is there. Average size of an X-ray room, as I said, 21 to 31 square meter, and 8 diagnostic rooms will have you 252 square meters. Various types of equipment which is there in the X-ray department, we were discussing earlier also, as Professor Arora also brought out, the imaging requirement is that you have a mammography equipment nowadays, which is simple, safe and reliable radiographic examination for the breast. Low dose X-ray study is there, and accommodation requirement is approximately 21 square meter. Ultrasonography, very important area where it's a portable and can go anywhere. non-invasive, non-ionizing study, high frequency sound waves, no discomfort to the patient, and accommodation requirement is also along with the toilet. That is very, very important aspect where you need to have a bladder requirement also seen. A CT scan is again come up a very important requirement. Then MRI is there. CT versus MRI, there is now no debate involved as such because of now it is very, very clear. The domains of MRI and CTs are very clear. Now we will talk about the AERB guidelines, which is a very, very important aspect. Structural requirement where the primary beam is falling should be more than 35 centimeter thick brick wall, and where the secondary beams are falling should be more than 23 centimeter. Number of doors should be minimum. Windows, as I said, are not required. Gantry of the CT unit should not be less than 25 square meter. There are requirements of the shielding, control panel, and various other requirements. You will see the layout I have shown you on the view file, where the primary beam is falling, protective barriers are required for any person who's taking the X-ray, protective barriers. Then the door has to be lead lined. Then you can see another view vis-a-vis the hospital corridor, where the windows are not being positioned that side. Various other requirement of a radiologist office, the layout of a radiology department is there. Various policies and procedures are required for hypo waste, waiting areas, proper identification and marking of the films, and film has to be tagged. Equipment management policies are required. So as Professor Arora also brought out in the beginning itself, we are now actually going to see the requirements from the quality side. Then the imaging requirements have to be as per the legal requirement. As I said, it's a statutory requirement. Then adequately qualified and trained personnel should be there, and the safe transportation of patients to the imaging services has to be there. Imaging results are available within a defined time frame. Again, similar requirement like laboratory, what we saw. There has to be an established quality assurance program. Then again, a big radiation safety program which is needed, where we require radiological safety officers as well as requirement of various appropriate radiation safety devices has to be there. So, Professor Arora, can we go ahead with the radiation hazards also?
I think if there is any question from the student, then we can take up that question.
Yes.
Otherwise, we can go down to.
Yeah.
Yes.
Small question, sir.
Yes.
Generally, we are talking about the hospital security and safety, and most of the centers have come up in the market, which are only imaging centers.
Yes.
And there, all the safety norms are not being taken care of.
Actually, I can answer your question by going into AERB guidelines.
Yeah.
Actually, for any X-ray machine which needs to be installed, there has to be a AERB clearance, and that has to be meticulously followed. Unless the drawings and design is passed by AERB, they cannot actually operate a center. So in this country there are various other requirements also, but this is a primary requirement in terms of all radiological installations, whether that is CT, MRI, X-rays, mammography, even cardiac cath lab. Generally people forget about cardiac cath lab. That is also a very, very important area where a lot of radiation is generated, and people tend to forget to take a clearance from the AERB for this particular purpose. Nowadays it has become mandatory. In fact, the machines itself have to be passed by them, then the design has to be passed.
Okay, then only they are installed.
Then only they are installing.
Okay, sir. Thank you, sir.
So I think what we can do, that we can request that for another 5-7 minutes you can cover. Although we have got 5 minutes, we can extend 2-3 minutes, and then we can finish this topic.
Yeah, sure. There are various requirements of lead equivalents, which is called shielding, like 1.5 lead equivalent has to be there for viewing window and fluoroscopy chair, protective aprons, protective gloves, gonal shields, and the cassette pass requirement, then requirement of the door. All this need to have certain lead equivalent available. Then only it becomes a protective equipment. And then occupancy in the X-ray room has to be seen. Assistance to patient should be minimal. Actually, no pregnant women should be holding the patient. Again, there has to be a barrier in between. Fetal protection. Notice in the local languages in terms of PNDT, organ shields, gonal shields, eye shields, thyroid shields. These are very, very important safety requirements nowadays. For the mobile equipment also, there is a requirement of the safety in terms of a screen. Especially a screen has to be there. And for fluoroscopy, of course, meticulously it has to be planned and stringent requirements should be followed. Servicing of equipment has to be done by a competent personnel, that is a registered engineer by the AERB. Again, there is a requirement of AERB clearance in terms of engineers also. Now the personnel monitoring is again a very important area which is often neglected by people. People don't wear these TLD badges, they don't keep any records. The radiation workers have to be continuously supervised for this purpose, otherwise we will be faltering on the radiation safety aspect. As we know that 10 millisieverts to 30 millisieverts is an area where the safety requirements have to be monitored. These TLD batches have to be examined quarterly by a person who is qualified in this. Nowadays BARC cannot handle so much load, so they have actually outsourced area wise. These batches are being monitored through these accredited labs. The worker safety, cumulative effective dose over 5 years should not exceed 100 millisieverts. Effective dose in a year, in a 5 years block, should not be more than 30 millisieverts. Then various requirements for the population, public also, that it should not exceed, dose should not exceed more than 1 millisievert. And for the trainees, in a calendar year, it should not exceed more than 6 millisieverts. There is a requirement of having a RSO, what is called radiation safety officer. It could be your radiologist itself, or as the grades increase, for example, if you have a nuclear lab or a radiation radiotherapy unit, then you need to have a RSO level 3 officer who should be aware about what is the requirement of radiation from radiation safety point of view. X-ray technologists, service engineers have to be qualified, and employers also should get into the detail what the question was asked just now. Various regulatory requirement, as I said, design certification should be there, type should be approved, there should be no objection certificate, approval of layout should be there, and registered X-ray equipment only should be used. Various RSO's duties, as I said, they are basically from the safety point of view. It has to be, area also needs to be monitored by RSO.
Colonel Rao, this RSO has to be a radiological person, or he can be any administrator? Or
He can be, sir, physicist also, especially when your level goes up in terms of radiation safety, that is in the nuclear labs as well as in the radiotherapy labs, radiotherapy centers, where there is an increased requirement of understanding what is radiation safety and implementing them in that particular manner. So your RSO has to be a physicist. Whereas in our in a hospitals where normal X-ray installations are there, they are RSO grade 1, that is your radiologist who is trained in radiation safety and certified by AERB. That is very important. Most of the hospitals actually forget to get them certified through AERB, that they have actually taken the training and they are certified.
Is it a mandatory?
It is a mandatory requirement as far as AERB is concerned. So we have actually gone into the details of radiation safety in terms of structural safety also.
You can just brief this up.
Yeah.
Sir, you just mentioned about RSO grade 1, 2, 3.
Yeah.
Are there specific guidelines mentioned about their selection criteria?
Yes, yes. As I said, level 1 is the lowest level.
Okay.
Lowest level, which I said is about your X-ray installations, where there is no requirement of in terms of nuclear medicine. You are not dealing with any radioisotopes, or you are not dealing with radiotherapy as such. There you can have a RSO level 1, then the grade increases RSO level 2 and RSO level 3, where all these things, there could be requirement of more than one RSO also, where you have many installations like mammography, then radiotherapy equipment, then you have nuclear labs. So there is a requirement of having more than one radiation safety officer also. These are actually available on the website of AERB or BARC also in detail. It is called AERB Safety Code for X-ray installations. So our students can actually access that and get into the details of each and every aspect, whether that is a structural aspect or a personal dose monitoring aspect or a requirement of radiation safety or clearances for various engineers. They are available freely without any charges on the internet.
Thank you, Colonel Rao. I think you have covered all the aspects related to the laboratory services and the radio diagnostic services within a prescribed period of 45 to 50 minutes. And you have given a very fair view of organization and planning of these two services. And moreover, you have covered also the hazards aspects related to the laboratory and the radiations. So I think if you see that PGD HHM4 course we have completed, laboratory services we have completed, radio diagnosis, blood transfusion we completed last time, pharmacy last time we have covered. So now in next session, that after 10 minutes we'll be going on to our course 4. Course 5. Except for the few questions from the audience here sitting in our studio, we have not had any question from any center in the country. So it's presumed that either the students are not sitting there, or either we are not able to communicate properly. I would request to all of you that if there are certain questions, please feel free to ask this question. So we'll be back after 10 minutes.